The purpose of this video is to demonstrate proper skin preparation prior to electrode placement for patients on telemetry. Routine changing of electrodes and proper skin preparation are important steps we can take to make sure our monitors are functioning correctly. Arrhythmia suspend and leads fail alarms are dangerous because monitoring is interrupted. If a patient were to have an emergency at this time, the monitor would not detect it. We will also demonstrate proper electrode and lead placement. Proper placement is crucial in identification of cardiac rhythms and cardiac ischemia. Skin preparation should be done on admission and with each scheduled electrode change. You want to begin by examining the patient's chest area where electrodes will be placed. You should look for areas of skin irritation, wounds, incisions, and check for implanted devices such as a pacemaker. If the patient has a hairy chest, it may be necessary to clip or shave the hair. You can use the blunt end of the scissors closest to the patient's chest to clip the hair, and this prevents injury to the patient. Next, you want to abrade the skin with a washcloth or a gauze pad to remove dead skin cells. Wash the application site with soap and water. And you want to dry thoroughly to remove oil, residue, and perspiration because these conditions can cause poor conduction. When replacing electrodes, you may need to reposition them if skin irritation is noted. Soft touch electrodes for sensitive skin are available if a patient has sensitive skin. New electrodes should be applied on admission to the unit. It is important that the same brand of electrodes is used as resistance varies between brands. Using the same brand creates an equal signal from all electrodes. Always use fresh electrodes, either a new pack or open pack that's been properly resealed. Electrodes can dry out if left open to air. Dry electrodes cause artifact. Okay. Next, we're going to apply the electrodes to the patient's chest. You want to select flat, fleshy areas. Avoid placing electrodes on bones, areas of muscle movement, on pacemaker or incision sites. You're going to firmly press down each electrode to ensure uniform skin contact. Do not press on the gel as this can cause it to smear. When removing the electrode backing, make sure to remove the small tab also. If this remains on the electrode can lift from the skin. Okay. Prior to placing the right arm electrode on the patient, make sure to date it and put your initials on it. The right arm electrode is placed near the right shoulder, just below the clavicle, in the second intercostal space. Ensure that the gel is in the intercostal space and not over the rib. The left arm electrode is placed near the left shoulder, just below the clavicle, in the second intercostal space. The V1 or VA brown lead is placed in the fourth intercostal space to the right of the sternum. The V2 or VB brown lead is placed in the fifth intercostal space in the mid-axillary line on the left. The right leg is placed on the right, just below the rib cage. And the left leg is placed on the left, just below the rib cage. Next, we want to apply the telemetry box. You want to put the batteries in the box. Make sure that the leads are connected to the top of the telemetry box. You also want to inspect the leads and the wires to make sure there aren't any frayed areas. The white lead is placed on the right. Black lead is placed on the left. The first brown lead, V1, is placed to the right of the sternum. The second brown lead is placed on the left under the mid-axillary line. Green lead is placed on the right below the rib cage, and the red lead is placed to the left below the rib cage. It's also important to change the batteries with each scheduled electrode change. If you're using lead wires that snap to the electrodes, connect them to the electrode first. Snapping the lead on after the electrode has been applied to the patient's skin can be painful. Leads with clips can be applied before or after electrode placement. If a patient has a pacemaker, it's important to not place an electrode over the pacemaker. You can place the lead on the left upper back if the pacemaker is located on the left chest wall, or the right upper back if it is located on the right chest wall. Our goal is to minimize the frequency of alarms caused by poor electrode placement or poor skin preparation. Your diligence in this process will help enhance patient care and safety.